Welcome to today's webinar, Preventing Elder Abuse Through Research and Practice Collaboration, the Empower Program Demonstration. My name is Susan Howley, and I'm the Project Director for the Center for Victim Research. The Center is a partnership between researchers and practitioners at the Justice Research and Statistics Association, the National Center for Victims of Crime, and the Urban Institute. The Center's mission is to serve as a one-stop resource for victim service providers and researchers to connect, to share knowledge, and to increase access to victim research and data and the utility of research and data collection to crime victim services nationwide. Today's webinar features a researcher-practitioner partnership, and we're so excited to share their information with you. Today's webinar and all of the activities of the Center for Victim Research are supported with funding from the Office for Victims of Crime, which is part of the Office of Justice Programs at the U.S. Department of Justice. And now it's my great pleasure to welcome our presenters today, Mary Lynn Kasanick, Jennifer Yahner, and Jeanette Huzman. And with that, I'll turn it over to our presenters.
Thank you so much, Susan, and thank you everybody for joining us today. My name is Jennifer Yahner. I'm a Senior Research Fellow at the Urban Institute, which is a nonprofit research organization based in Washington, D.C. I'm also the Associate Director of the Center for Victim Research and a volunteer long-term care ombudsman for older adults. I'm also going to be co-presenting with my colleague, Jeanette Huzman, who is a Principal Research Associate, also at the Urban Institute, and she has a background in community social work as well. And Jeanette and I have been privileged to be working alongside Mary Lynn Kasanick, who is the President, CEO, and Executive Director of the Area Agency on Aging, Region 1, who serves a very large population of older adults in Maricopa County, Arizona. The three of us are really excited to talk to you about a researcher-practitioner collaboration we've been working on for 2 years now, focused on building up the Empower Elder Abuse Prevention Program. And before we get started, I just want to acknowledge a large number of voices and expert advisors and stakeholders who have contributed to the development of this program. First and foremost, the National Institute of Justice funded this effort. We're very grateful to them for that. And especially grateful to Brett Donahue and Carrie Mulford for guiding us along the way. They also brought two fantastic Department of Justice advisors, Shelley Jackson and Sid Stahl, to the table, who really also contributed a lot. And we've been grateful to have four fantastic project advisors, Dr. Sherry Hamby, Dr. Tony Rosen, Dr. Pam Teester, and Paige Ulrich. All were integral to building up parts of the Empower program. And then, of course, we're very grateful to our partners in Maricopa County, Arizona, particularly the Area Agency on Aging, Region 1. And you'll be hearing from Mary Lynn, of course, today. But we also want to thank Melissa Elliott and Heidi Doniacqua for being part of this from day one. We were able to also consult with the Maricopa Elder Abuse Prevention Alliance and get their feedback on things. And we're very dependent on the Senior Adult Independent Living program that the Area Agency operates, the case managers that work for that program, and their older adult clients who are the study population that we're looking at. And then through the Area Agency, we were grateful to get connected with the Adult Protective Services Division of the Arizona Department of Economic Security, who also understands the importance of this project. And then in our next phase that we're about to launch, the pilot study effort, we are partnered with the Arizona State University's Southwest Interdisciplinary Research Center, and specifically Wendy Wilfer-Stig and Maria Aguilar-Amaya are going to be really integral to helping us with the on-the-ground interviews with older adults. So just to give you an overview of the flow of this webinar, I'm going to start by talking to you about the background of this project and how it got started. And then Mary Lynn's going to talk about how the Area Agency and the Urban Institute got connected. And then we're both going to lead you through the development of the Empower program, and you'll hear from Mary Lynn about the different modules that the program includes. And then my colleague Jeanette is going to talk about the multi-phase evaluation approach that we've adopted. And we'll talk a little about some of the challenges that we identified, as well as our successes. And then finally, we really are grateful to be talking to a community of people who really care about elder abuse and elder abuse prevention. So we would love to get your feedback on things and hear what you're doing in your communities. So I think most of us understand that elder abuse is a very critical and growing problem. The best numbers out there right now point to about 1 in 10 older adults self-reporting some type of elder mistreatment. And that includes physical abuse, sexual abuse, financial exploitation, emotional or psychological abuse, and even neglect or abandonment, and perhaps most commonly neglect. The type of elder abuse that we've been focusing our efforts on are those that involve the dyad of a person of trust in the older adult's life and then the older adult themselves. So it could be a family member, a caretaker, or somebody who is involved in controlling the finances, like your accountant. So we're focusing on the violation of that trust relationship. And even with this large number of 1 in 10, we know that those numbers are going to be on the rise as the proportion and number of older adults in America increases astronomically over the next few decades. People are living longer, and now we're looking at a doubling of the number of older adults by the year 2060 to almost 100 million. And we are focused on people who are older. That's the population that the area agency serves, and that's the focus of our collaboration. So given this big problem, we actually don't have many programmatic efforts out there that we're aware of that are specifically focused on preventing elder abuse before it occurs. And these are primary prevention programs that we're talking about. We do know that our good colleagues at the Medical University of South Carolina, these are the people who headed the National Elder Mistreatment Study. We know they're focusing on developing a program that really increases social support in older adults' lives. And we also know that our sister demonstration project that is being run by the University of Southern California in partnership with Kaiser Permanente, we know they're developing a program targeting older adults with dementia and their caretakers. And then we know about our program that we're going to be talking to you about. But we really don't know about any other specific elder abuse prevention programs. And most of the efforts that we are aware of really focus on intervening after a potential elder abuse case has occurred. And we know that multidisciplinary teams or forensic centers really do a good job of breaking down the different elements of an elder abuse case to try and find some type of solution. It's still a very challenging situation, but that's most of the attention, I think, has been on intervening after elder abuse has occurred. And I would like to just open it up to everybody who's here. Do you know about something that's going on in your community, or have you heard about something that's going on nationwide that I didn't mention that is really designed specifically to focus on preventing elder abuse? And maybe we'll go ahead and you can either let us know, we would love, if you do, for you to share that with everybody in the chat box, or else just check the green box, just because I am curious about other efforts that are going out there, that are going on out there. And, okay, so now to talk about our specific effort. In 2016, the National Institute of Justice funded 2 research and practice demonstrations specifically focused on developing and evaluating a program to prevent elder abuse. And the program that the Urban Institute and Area Agency developed is targeting older adults who don't yet have some type of serious cognitive deficit. They're still able to live independently in the community, but they're identified as needing they've reached out for some type of help. So they are lower income, unable to provide that help for themselves. So we've identified a vulnerable population who are living at home in their community, isolated, that need some type of help. That's our target population. And our partners at the University of Southern California, as I said, are working with Kaiser Permanente. They're developing a program that targets older adults who have some type of dementia and their caretaker when they come and visit Kaiser Permanente for some type of medical appointment. That's the moment at which they're trying to recruit people for participation in their prevention program. And we do hope through the Center for Victim Research to be able to share a webinar focused on the University of Southern California and Kaiser Permanente's program later on in this year. And I apologize, in the year 2020, they'll be able to share some results. So, and the other thing I wanted to say is that this demonstration was specifically funded as a multi-phase demonstration. NIJ started with a planning phase so that we would have time to put together a strong program and the elements involved in doing an evaluation of that program. And then the next phase was the funding of a pilot study. That's the phase that we're in right now. And then ideally, if it looked promising, NIJ would fund a full-scale implementation of the program in a very large research study so that we could assess its effectiveness on elder abuse. Okay, so now I'm going to turn it over to Mary Lynn to talk about how we got connected with the area agency.
All right, thank you, Jennifer. So it was probably more than 2 or 3 years ago that I got a strange call. I like to call it a strange call from Jeanette from Urban Institute, who said that they wanted to connect with us on a research project. I'm like, we're very much, as an area agency, a practitioner. And I'd ask them, well, why did you call us? And they said, well, you have some national notoriety on some of the unique programs you're doing around elder abuse. And we have been working on elder abuse prevention through what Jennifer mentioned as Maricopa Elder Abuse Prevention Alliance, which started in 1992. They were also interested in some of the other programs we were doing in response to elder abuse. But through our discussion, several phone calls actually, what we discovered in order to look at prevention, we really needed to focus on a group of people that weren't currently getting services. And unfortunately, because of lack of funding, we have 1,200 people on the wait list for home and community-based services, and they often wait up to a year. And so they are isolated. As Jennifer had mentioned, they did call and say, hey, I need help, but we didn't have the funds to serve them. And so the more we talked about it, we finally agreed to partner with this project, and we're glad we did, because it's an exciting project which you'll learn about in the next coming slides.
Thank you, Mary Lynn. And I apologize for the audio. I hope this sounds clear, and we'll make sure we stay right up near the phone. And so we have 2 audience polls that we hope to ask you guys. The first one is, have you worked in a research and practice collaboration before? And, you know, the choices are yes, you have, and it was focused on elder abuse or older adults. Yes, I have, and it was focused on other topics. No, I have not yet worked in a research and practice collaboration, or it does not apply to my situation. And while everyone's taking a moment to answer that, I'm just going to flip ahead. And I'm so sorry, Casey, did you flip the slide ahead?
My screen is frozen because the poll is populating, so one moment.
Okay, that's okay. We'll wait.
There we go.
Okay, thanks. So once we got connected with Mary Lynn, and it was really clear that we had to outline what role each agency was going to play. So obviously we wanted to work in partnership with each other, but we wanted to also maintain the integrity of the research process. So we decided that clearly Urban Institute would lead all of the activities focused on evaluation of the program's effectiveness, while the area agency, of course, would actually implement and deliver the program to older adults. But together, we have facilitated the development of program materials and also the operations of research activities, and then together we would also share dissemination of findings from this effort. Just looking back at the poll, it looks like there's a mix. Looks like 23 of you have not yet worked on it, any collaboration, but the same amount have worked on some type of evaluation of collaboration, and 12 people have worked on an elder abuse research and practice collaboration. So that's good. I think this is a growing area and a good way to move forward, especially in this field where we need to benefit from each other's expertise. So next we're going to talk about the actual Empower program. How did we go about developing it, and what is it? What modules does it focus on? So first we started by trying to conceptualize a theory of elder abuse. Why do we think that elder abuse occurs? Now, there are obviously a large number of different types of elder abuse and a large number of different reasons, but we needed some type of basic theory to focus on. And so you don't have to look at all of the arrows in this diagram, but the essence of it is that there's a number of different factors that are protective against abuse occurring and risk factors that make it more likely for abuse to occur. And those factors are things that are reflective of characteristics of a person of trust in an older adult's life, also characteristics of the older adults themselves. And then together, they're operating in a social and cultural environment in which elder abuse may be more or less likely to occur. All of those factors will increase not only the opportunities for abuse or triggers, but also the older adult and the person in trust ability to cope with those triggers and those strains when they occur. We decided that the Empower program was going to focus specifically on older adults and building up protective factors in them. We couldn't target all of the people of trust in those older adults' lives, and we wanted the program to be positively focused on building resiliency in those older adults as they aged. And so once we had this understanding of the theory, we built a pretty complicated logic model, but this is sort of the essence of it all. What we had to define, what are the specific goals that we're going to be focusing on with this program, and what are the activities that we're going to engage in order to accomplish those goals, and if everything went successfully, what are the outcomes that we would expect to see from that program? So the specific goals of Empower are to strengthen the older adult's home environment, their physical health care practices, their emotional well-being, their social connectedness or positive social support in their lives, and then their financial well-being and planning for the future. The activities, the actual activities of the Empower program are that it involves 12 one-hour weekly home visits by a program facilitator. And each visit is focused on helping the client develop some goals in each of these areas and really some concrete but simple action plans to start taking steps towards accomplishing those goals. And the facilitator also connects the client with any resources they're aware of in the community that could be helpful. And in the pilot study effort, where we're just looking at a client situation before and after, immediately after participating in this program, we're hoping to improve some short-term outcomes that are related to helping them strengthen social support, their emotional and physical health, and their financial well-being. Long-term, in the full-scale implementation, we do hope that if older adults are able to do all of these things, they would ultimately have a reduced vulnerability to elder abuse. Now I'm going to turn it over to Mary Lynn to talk about the program itself.
All right, thank you, Jennifer. As Jennifer pointed out, this really is about developing protective factors, and we call the program Empower, Building Late Life Resilience. We determined the program eligibility, which she mentioned briefly before, that it was adults 60 and over. They had to live alone in the community, not be institutionalized. They could speak either English or Spanish. They would have no moderate or severe cognitive deficits and no untreated substance abuse or mental health problems. And so how we decided to deliver this program is through 7 modules. And the first module, Module 1, was the assessment. If we can have the next slide. And in this one, we're building rapport with the client. And so we're assessing them for home safety, health care, medical care, emotional health, finances, relationships, and so forth. And we try to understand the client's strengths and resources and help them understand also their strengths, like internal, positive outlook on life, courage, wisdom from life experience, or their external strengths such as support from family, friends, or community. And we also explain to them that there's a limit on confidentiality, that we are mandated reporters, and so if we suspect elder abuse, we will need to report it. And the tools that we give them in the first module is an empowered journal that has action plans in it, and it's basically a place for them to write anything that they would like to change about their life. We give them a pen, and we also give them a magnet of crisis counseling in case they, in between visits, feel the need to call. In Module 2, we looked then at home safety, and we felt like this was the least threatening to talk about, was their home. We asked them to discuss the story of their home. Do they feel safe there? Who do they let in? And we really engaged them in making sure that their home is safe, including having good lighting, removing loose rugs so they don't fall, putting grab bars in the restroom, locking their doors, not opening their doors to strangers, and so forth. And so, again, we have a home safety plan where we ask them, what's your vision for a safe and secure home, and is there anything that you can start working on to make your home feel more safe, such as remove the throw rugs or install deadbolt locks or peepholes. And so we also give them an automatic night light so when they get up in the middle of the night, it's not completely dark in their place. In Module 3, we look at their physical health. And again, we talk to them about the importance of having a good connection with their doctor, about medication adherence, exercise, emergency preparedness, and we're empowering them to do better self-care and encourage them to do chronic disease self-management. And so what we do is, in that one, the action plan, we ask them what things can you work on improving, and we give them a personal health record so they can keep track of their doctor's appointments and their medication. We give them a Vital Life emergency kit, a pill box, a medication disposal envelope. And if you're not familiar with the Vital Life, it's a form you fill out that has your medical conditions, your medication, your primary doctor, and so forth, and you put in a baggie on your refrigerator so that in case you have emergency personnel come in, that they'll be able to know right away what they're dealing with. In Module 4A and 4B and also Module 5 are the ones that take really the most time. We're talking in 4A and 4B about their emotional well-being, emphasizing the connection between thoughts and feelings and behaviors and gratitude and health, and ask them for their action plan to answer the question, what does healthy emotional well-being mean to you? What can you do to improve your emotional well-being? And one of the things we emphasize is a gratitude journal, which we give them, and realizing that being thankful and showing appreciation in your life is a way to increase life satisfaction. We also discuss some tough topics such as grief and loss. In Module 5 is also a very important one about social connectedness. We know as people get older, they have less and less family and less friends. But we talked to them about it's very important to identify the people in their life that can provide them positive social supports, and also talk to them about, the impact of negative relationships. We give them a large print calendar so they can write activities that they might want to be able to do, and then we give them a booklet, a guidebook on a great program that was formerly called Senior Centers Without Walls. It is now called Well Connected, and what it is pretty much a phone, a series of phone discussion groups where they can sign up for a book club, they can sign up for poetry, they can have armchair travel, conversations about sports and talk and about arts and so forth. And so even if they are homebound, that they can not be totally isolated, but being talked to people, other people throughout the United States. We also encourage them to be calling friends and family more often and being engaged in some of their hobbies like reading clubs and playing card clubs. And then Module 6 is about their financial well-being, and we discuss a variety of topics about protecting their assets and also about power of attorney, joint bank accounts, living trusts, living wills, and wills. We have them work on their action plan again, give them a money management guide, and also give them the document called 5 Wishes. And that document is like where you put in writing the person I want to make my care decisions for me when I can, the kind of medical treatment I want and don't want, how comfortable I want to be, how I want people to treat me, and what I want my loved ones to remember about me. And then finally, in the last module, Module 7, is what we call the empowerment plan. We review all the other modules, reemphasize all the community resources, and we, encourage them to look at their strengths and their resiliency. The Empowerment Action Plan that week is called Moving Forward. We encourage them to seek help from other people, from trusted friends, families, and agencies, and to always make sure that they have safety planning, and let them know that they can be a target, but they don't need to be a victim of abuse. And we encourage them to reach out to trusted social connections. We also give them an elder resource guide that lists many resources in the community, encourage them to reach out for the help when they need it.
Thank you so much, Mary Lynn. And next we come to our second poll for everyone who's listening. And we'd really like to know what you think. What strengths or resiliencies do you think older adults need the most to protect against elder abuse? Strong, positive social relationships and support, healthy emotional well-being and self-care, and you can check more than one here. Good physical health and healthcare practices, solid money management and advanced care planning, or something else, other. And if you do click that other box, if you don't mind hopping over to the chat box and sharing what other resiliencies you think are really important, we'd really love and appreciate learning from you. So I'm going to just take a moment and let everybody take the time to finish this poll, and then we can share results. Oh, that looks like it just finished. Okay, overwhelmingly, strong, positive social relationships and support. That's definitely a major conclusion of the National Elder Mistreatment Study. They found that 8 years later, the people who had strong, positive support in their lives were less likely to have experienced abuse and also better able to recover from those abuse experiences. But also equally, just as important are healthy emotional well-being and self-care and solid financial planning, absolutely. and then, of course, healthcare and other. And I will pop over and read those later after the webinar. So next, we're going to hear from my colleague Jeanette about the multi-phase evaluation approach that we're taking to evaluate this program.
Thanks, Jennifer, and thanks, Mary Lynn, for your overview of the Empower program. As Jennifer suggested, I'm just going to take a couple of moments to walk through some slides to talk about the research component of our program. Earlier on in the webinar, Jennifer talked about the phased evaluation approach to this project, and so I'll just talk a little bit more detail about this. We were really grateful. The funding for this program started with a planning phase, which was about 15 months, and that provided us an opportunity to work with area agency, to work with our stakeholders and advisors, and to spend some real time thinking about program development, the logic model, the theory behind the program, as well as what kind of outcomes we were interested in, and what kind of data collection we needed to do to assess those outcomes. After we finalized our products and the program, we were able to do a pretest with 11 older adults in Maricopa County, and this was just a wonderful opportunity to really see how the program is implemented and to be able to test out our survey collection protocols and to hear, the voices of those individuals who were involved in the program, give them some time to tell us what they liked, what they don't like, what they didn't like. We took all of that feedback and made some revisions to the program. And now as we enter the pilot study, we feel like we're in a good place to really be able to do this initial rigorous assessment of Empower. And so we're getting ready to launch our pilot study. This is going to include 500 older adults, half of whom will receive the program. We will be conducting a process evaluation and looking at the short-term outcomes that Jennifer discussed, including social connectedness, physical health, financial well-being. And then at the end of this phase, we will be publishing, of course, the results, but as well also disseminating the Empower Toolkit and the study methods and data collection methods for others to implement. And also, we are really hopeful that in the future we're going to be able to move into a full-scale outcome evaluation and include a larger sample and to be able to look at those longer-term outcomes that we're interested in. For the time being, we're going to be jumping into a randomized control trial here for the pilot study. So as Mary Lynn and Jennifer have talked about, we're going to be relying on those individuals who are waitlisted to receive services, half of whom will receive the treatment and receive the Empower program, and the other half who will remain waitlisted for services. And in order to implement the randomized control trial, we are going to be recruiting individuals both via phone and through brochures and mail-outs to individuals who are on the wait list, indicating, of course, that their participation is voluntary. Those individuals who are a part of the study will be fully consented. They'll understand the randomization aspect of the study. And all of them regardless of whether they are randomly assigned to the treatment group or the control group, will complete two in-person interview surveys, which will be conducted by CERC, our partners at the Arizona State University. So we'll do an initial baseline pretest, which will occur actually before we randomly assign individuals to either the treatment or control group to receive Empower. And then after the Empower is implemented, about 4 months later, we'll circle back around with everybody to administer another survey, which is going to be really allow us to look at those short-term aspects. Considering everybody's time, we're offering an incentive, so we're giving everybody a $45 gift card after the first pretest. or after the first survey, and then $50 after the second survey. And additionally, we're really lucky. APS has been really supportive of this program and this study, and so we'll be looking at official reports of abuse as well.
Great, thank you, Jeanette. So the last thing we wanted to just sort of touch on were some of the challenges, the research challenges that we came across in our pretest. And then also some of the adjustments we made in response and what we consider to be the successes of our efforts so far. So first of all, it is really difficult recruiting and retaining older adults for a study of this size for a 3-month program. Their lives can be very challenging. Often, many of them are facing a number of healthcare issues, dealing with multiple doctor appointments. They may be in unstable housing situation or, having a changing financial situation and problems with their family. It also became clear that men were less likely to want to talk about their feelings in a program like this. It does involve conversations about emotional well-being and social connectedness that men were a little bit more reluctant to dive into. So really, the takeaway from that was that we really needed a program facilitator who was really skilled at building strong rapport with the client. And then from the research point of view, we recognized from the Pretest experience that we really needed to increase our recruitment outreach efforts. We were going to just rely on the phone, but we realized we'd also need to mail out brochures informing people about this opportunity. We did not offer any incentives for the pretest experience. We knew that we would offer incentive amounts for the pilot study, but we also realized that we had to increase those amounts to be more respectful of the commitment that we were asking from these adults. And then lastly, we reduced the time to connect. So as soon as somebody expressed interest in this study, we wanted to hook them up right away with somebody to do that pretest interview and let them know right away whether they were going to be a program participant or part of the control group, but still equally important to the study. And one of the things I didn't list here is that during the pretest experience, it was a small number of people, but we did hear very positive feedback from the older adults who participated. They were appreciative of the chance to talk to somebody about the different issues that they were facing. Some of them didn't know about some of the financial, like even just the forming of a will. Someone didn't know, practically speaking, how to get that done. So there was different practical advice, and then also just overall having somebody to talk to about the process of growing older was what they reported as being helpful to them. But the big takeaway for us is that we really feel like we've built up a strong research practitioner collaboration here with the Area Agency on Aging. And a lot of that is attributed to the frequent communication that we have. We've been talking weekly, pretty much once a week for at least 2 years now, often communicating by email in between. And through that, we've developed a mutual respect for each other's expertise. We definitely are grateful to the Area Agency service providers for all of the expertise that they bring, having worked with older adults for decades. And we think they've also grown to appreciate some of the aspects of research that are really important to helping us tease out whether something is actually having the effect that we intend it to have. And then we've also been very grateful, of course, as I mentioned in the beginning, to have the interaction with a lot of project advisors and partners and stakeholders in Maricopa County who were able to give us lots of feedback on the development of the program and also how the evaluation looked. And so we're really excited as we begin this new stage of launching our pilot study. And so that concludes our part of the presentation. We really thank you all for participating, and I can already see there's a lot of rich information about elder abuse prevention efforts that are going on in everyone's community, so we look forward to reading through that. We would welcome any questions or comments, more comments or feedback. If you want to reach out to any of us afterwards, here's some contact information for Mary Lynn and also for my colleague Jeanette and myself, Jennifer. So feel free to email us with any questions or other information. I did see someone saw a question about the slides, and so we will be making a copy of this presentation available along with the recording on YouTube to everyone who's registered. So, Susan, I'll turn it over to you. Yeah, go ahead.
All right, thank you. We do have time for questions. I know a lot of you out there work with elder victims, and this is your opportunity to ask Mary Lynn or the researchers any questions either about how the empowerment program works or how this research process works. If you could just put your questions in the chat box. I saw we had one question. Jennifer, when do you anticipate having a toolkit available?
Yeah, no, that's an excellent question. We were almost ready to share everything at the end of our planning phase, but that was too preemptive. So definitely at the end of our pilot study phase, which should be in probably early 2021 or winter of 2020. But we do have a summary report coming out that gives a lot more information than what I've conveyed here. It's in the hands of the National Institute of Justice and should be published imminently. We know it's gone through all but the last phase of approval, so yeah.
Great. And when you make that toolkit available, will people be able to get copies of the materials such as the Gratitude Journal, which sounds so fascinating, and the 5 Wishes documents and the other things that Mary Lynn discussed?
That's a great question, and Mary Lynn, I'll let you weigh in too. But absolutely, what would be part of that toolkit and what we've been really working hard to develop is what we call the Facilitator Manual. I think it's almost 200 pages of different topics and resources to be covered during these 12 weeks of conversations. But some of the items in it we've drawn from other resources. The 5 Wishes document specifically, anybody can get that. If you Google 5 Wishes, it'll come up right away. You can get a copy of that. Mary Lynn, maybe you can talk more about that if you want. And the Gratitude Journal too is, it's just the concept of having people fill out something that they're grateful every single day, or that they would like to.
Yeah, as Jennifer said, the 5 Wishes, you can either purchase it online. Just type in 5 Wishes is through Aging with Dignity, and you can either download it there or you can order them, and I think they were like $1 a piece or something like that, but it's a great document. The other thing I would encourage you, and if you want to email me, I can send you a little more information. But again, go online to that Well Connected, which is a program out of San Francisco that's really a great way for people that are homebound and isolated for them to get on the phone. Sometimes they have webinars, but get on the phone and be a part of a discussion group and not be so isolated.
Thank you. We had another question. Can people recommend participants to the pilot study? And if so, do they need to live in Maricopa County?
We are, I think for research purposes, and I can let Jeanette and Jennifer respond to this, but we are using the people on the waiting list, and then they're doing randomization if they get the intervention or they don't. Because it's an in-home program with weekly visits for 12 weeks, we would not be able to do it outside of Phoenix and the greater Maricopa County.
That's a great answer, Mary Lynn. And related to that, I did see, Susan, you shared a question about what happens to the control group. So I think as Jeanette shared, they both stay on the wait list for whatever services they've sought from the Area Agency on Aging, which to my understanding is typically something like the installation of security bars in their home somewhere or some type of housekeeping services that they feel like they need. Anyone that has an urgent need for services does get that need met. But it's the other people who have some type of need for which the resources aren't yet available. And as they become available, those people will get those needs met regardless of whether they're receiving the Empower program or not. And Mary Lynn, I don't know if you wanted to add anything to that.
Yeah, so they are the typical client who calls up or the family calls up and says, you know, we need help with home care, such as personal care, grocery shopping, laundry, light housekeeping, and because of the lack of resources in Arizona, we have a waiting list of 1,200 individuals. And as you know, Jennifer said, they are screened by phone and prioritized, and then if they are a high priority, they go over to SAIL Case Management, who does an in-home assessment, and those that are in desperate need of the service in order to continue to live at home do get services right away. Other people, unfortunately, based on their priority scale, go on a waiting list until there are slots open or funding available. So it's an unfortunate aspect, but it did give us a great research sample population.
Great, thank you. Another question we had, does the home safety training include internet safety, which is such a big issue these days?
I think there is some discussion about, a little bit of discussion about internet safety.
Yeah, that's absolutely right. And it actually, I think, falls in the financial well-being module. But I think that's important for us to touch on in the home safety module, too. So I think we might add something like that. But we definitely touch on that in the financial well-being module.
Because we look at, in the financial well-being module, we look at a lot about scams and threats and, you know, phone calls, robocalls, all of that, to look at how identity theft and so forth. And so that is a great place to really emphasize the internet safety issues.
And I do see another, do you want me to, Susan, I see
yes,
a couple
please.
of questions. Okay. So does your research exclude all seniors with disabilities or just those with cognitive disabilities? Definitely people who have physical disabilities are a part of this. I think it was really just a cognitive, we couldn't be prepared to work with people who had dementia on this type of topics with this type of program. As I mentioned, our sister demonstration project is specifically focused on people who are suffering from dementia and their caretakers. So there should be good information about that coming out soon. Culturally, oh, go ahead.
Well, I just wanted to add that all of the individuals on the waiting list have a deficit in activities of daily living, like they're not able to cook, they're not able to bathe themselves, and so forth. So all of those individuals have generally physical limitations to continue to live at home, so they are not excluded at all.
Yes, thank you, Mary Lynn. Someone asked about Spanish speaking. We are serving both English and Spanish speaking people. Somebody asked an important question about how can your evaluation tell whether it's actually working? And that really gets back to that random assignment process. So we're looking at two groups of people who otherwise are identical. Half of them, the only big difference is that they're getting this program and the other half are not. And so when we compare what those people looked like before, you know, at time 1 and then 3 months later, we can feel fairly confident that any difference we observe in these outcomes is attributable to the program. We can never feel certain, but this design of the idea of randomly assigning people is actually pretty much the strongest design that you can have in a social science research project.
Great. There was another question that asked whether Center Medicare, Medicaid, or Social Security have information sessions or workshops to educate seniors on their entitlements and supportive services. I know that's a little bit of a side question, but as part of this project in building resilience, do you provide information about these resources that are available?
Yes, we do. We do talk about you know, for example, the Medicaid, Medicare. But I think most importantly, because we are an area agency on aging, we have a whole wealth of other resources that we can refer people to. We have a program called Benefits Assistance. Many area agencies and across the nation might know it as the SHIP program, which is a state health insurance program. And we're able then to go in and work one-on-one with the individuals, either in their home or at a drop-in site or by phone, and help them understand what their options are, especially during open enrollment for Medicare.
That's
Thanks,
great.
Oh, go ahead.
I was just going to say, while we're waiting for additional questions, I do want to remind people to please take the exit poll before they leave for the day, but we do have time for some more questions.
Well, I'd like to make a point, too. I think as an area agency on aging, we have over 50 programs, so anything that we see that the individual in their home, you know, some other referrals that they might need, maybe utility assistance, you know, as Jennifer mentioned earlier, grab bars that they might need and so forth. These are things that we can always refer them to. And that's one of the main reasons why the last module we give them our Elder Research Guide, which is a pretty comprehensive guide of all the different services that are available in the community for older adults that we're aware of.
Thank you. And I did see a quick question about a maximum number of people involved, and that really has to do with the amount of resources we have for the study. And so we did plan for 500 people to be involved in the pilot study, and that half of them, 250, will be able to get that 12-week program, and the other half will stay on the wait list. Obviously, with more resources, you can serve more people. And then once we find out whether this is actually effective, that's really when it becomes a decision, on the part of the state and the area agencies and the federal government on what they want to invest their money in funding. So we're hopeful. We're hopeful that there'll be more attention to these efforts, these types of efforts moving forward.
Thank you. We had another question come in. In terms of participation, are there any issues with cancellations, or are you having any participants drop out?
Oh, yes. That was, I think, one of the biggest things we learned through the Pretest experience, which I sort of touched on. How do we retain them in this sample? We certainly are being flexible. I think we've allowed for up to 3 weeks in order to schedule that next appointment with somebody. We even had the last program facilitator go and visit someone in the hospital. They were welcomed to go and visit them and to talk about the module. And so we're trying to be as flexible as possible. And then also maintain communication by phone, even when not able to visit in person. But that's definitely a challenge.
All right, I believe that concludes the questions for today. Folks, you'll see the contact information for today's presenters. I'm sure they would welcome follow-up questions. I want to remind you that if you would like a certificate of attendance for today's session, please email liaison, we changed her email address. Email ask@victimresearch.org. That's ask@victimresearch.org, and we can get you a certificate of participation. Once again, we will be sending out a link to the recording and today's slides, along with any other additional information that we think would be useful to you. Thank you, presenters, Mary Lynn, Jeanette, Jennifer. This has been really exciting, and I, for one, am looking forward to the results of this study.
Thank you so much, Susan. Thank you, everyone who joined. Thank you, Mary Lynn, too.
Thanks.
Take care.